Good morning, students. This is the class for Diploma in Pharmacy students, not only for Diploma in Pharmacy students, even it will be useful for B.Pharm students, PharmD students and M.Pharm students and writing examinations. This is for exit exam. The subject which I have taken for today for the discussion is Pharmaceutical Jurisprudence MCQ. Pharmaceutical jurisprudence, previously we can say it is forensic pharmacy, pharmaceutical jurisprudence. Even the students can revise their knowledge, and even if the students who are studying in Sri Krishna College of Pharmaceutical Sciences, diploma students, degree students and PG students, they can revise your knowledge and revise even the subject which is going on, and you can listen to this class. And other students who are preparing for their exit exam to be conducted on October by Pharmacy Council of India, it will be necessary for you to revise your knowledge. So this is, I have taken very simple little 15 questions which can be discussed today. In that first question, license is issued for bonded and non-bonded laboratory by whom? That is the question. So we should know what is bonded laboratory and non-bonded laboratory. Already we might have studied, but still I need to give you some idea about that. What is a bonded and a non-bonded laboratory? The main difference is that a bonded laboratory is authorized by government to handle the test controlled substance, while a non-bonded laboratory is not authorized to handle controlled substances. So you should know that if there is alcohol, if there is narcotic, drugs which may be present in the formulation or in the production, it is needed for bonded laboratory to get the permission. And from whom you have to take? That is our question now. The license of bonded and non-bonded laboratories is issued from the office of the Excise Commissioner of the state of alcohol. The bonded laboratory should be unlocked and locked in presence of an excise officer and held with excise ticket lock. So that much control is made by the excise commissioner. So every state will be having this excise commissioner office. They are given a choice. The question, license is issued for bonded or non-bonded laboratory by the central government? No. State government? No. Director of Health Service? No. It is given by excise commissioner. They are given 4 choices. The answer is excise commissioner. I hope that why this is the answer which you have to select very clearly for the issuing the license authority. And now number 2, NDPS. We should know what is NDPS. NDPS constitute constitutive committee consists of maximum of number. So it's a committee which is having how many numbers, how many members? What is it? NDPS means Narcotic Drug and Psychotropic Substances Consultative Committee. So you can see that the central government may constitute by notification in the official gazette an advisory committee to be called the Narcotic Drugs and Psychotropic Substances Consultative Committee. So it's very clear the narcotic and drugs have to have control, which is having a committee, constituted committee. So how many members? The central government appoints this advisory committee to advise central government and state government on the matters pertaining to NDPS. Don't forget, NDPS means Narcotic Drugs and Psychotropic Substances Act 1985. The committee consists of chairman and not more than 20 members appointed by central government. So the question says maximum of not more than 20. So you can see 20 is the answer should be. They have given 15, they have given 10, they have given 25 because we know that it should not be more than 20. So the answer is 20. So now it is very clear, and even if they ask, the students should know that what is NDPS Act 1985. Number 3, the president of PCI is, that everybody knows, president of PCI. The Pharmacy Council of India is the statutory body under Ministry of Health and Family Welfare, Government of India. It constitutes under the Pharmacy Act 1948. The council was first constituted on 4th March 1948. Now at present, Montakumar Patel, Dr. Montakumar Patel is elected as the new president now. And the president and vice president of Central Council shall be elected by the members of the said council. From among themselves they will select. So 6 members, teachers of each of the subject. There are many subjects, so 6 members from each teachers will be selected. 6 members practicing pharmacy. 1 member Medical Council of India. The Director General Health Service, that is the Drug Controller of India, and as an ex officio member. The Director of Central Drug Laboratory as an ex officio member. A representative of UGC and AICTE. A representative will be a member. 1 member to represent each state council who shall be a registered pharmacist. 1 member to represent each state government who shall be a registered pharmacist. So they have given a choice like nominated by Health Secretary, Government of India. No. Elected by registered pharmacist? No. It is elected by its members. So you should know all the members. There are many members, even teachers 6, practicing pharmacists 6, 1 Medical Council of India, Director General, ex officio member. These all members together, they will elect this president of Pharmacy Council of India. So they have given a choice, none of the above also. So the answer is elected by its members. Who was the first chairman of Drug Enquiry Committee? First chairman. Given a choice, B. Mukherjee. We should know who is Mukherjee because he is related to pharmacy. So you should know Dr. B. Mukherjee remained associated to different capacities in making the Pharmacopoeia of India in 1955 and 1960 supplement, and also the Pharmacopoeia 1966, which was a big volume. It was a very famous one. Still it exists in 1966, and now we have developed up to 2024. And he was a member of the first Indian Pharmacopoeia Committee formed in 1948 and constituted in 1955. So, we should know about B. Mukherjee also, but he is not the first chairman of Drug Enquiry Committee. Sir Joseph Board. Who is this Sir Joseph Board? Health Survey and Development Committee in the year 1943 under the chairmanship of Sir Joseph Board. So he is also Development Committee, Sir Health Survey Development Committee in 1943. So this is, and you can see R.D. Dahl is not also the first chairman of Drug Enquiry Committee. Colonel is an army colonel. R.N. Chopra is the answer. He was, even an Indian stamp also have been established in his picture. And you can see the colonel. The government of India is pursued to the resolution appointment of committee known as the Drug Enquiry Committee in 1928 itself. Before the Drug and Cosmetic Act, 1928 itself, the government of India on 11th August 1930 appointed the committee under the chairmanship of late, that is Colonel R.N. Chopra, to see into the problems of pharmacy in India and commanded the measure to be taken. He was recommended, not commanded, recommended. He was recommended to measures to be taken in pharmacy. Punishments to contravention in relation to ganja. You know, ganja is most of the time hilly area. In Idiki and many other places they used to cultivate without the knowledge of the government. And if it is, what is the punishment? Punishment for contravention in relation to cannabis plant and cannabis, and even related to ganja, 5 years and 50,000 rupees is the fine. If it is related to cannabis and other than ganja, then it is 10 years to 20 years imprisonment and 1 lakh to 2 lakh rupees. But only in ganja means 5 years and 50 years rupees. So they have given the choice 10 to 20 years imprisonment, 1 to 2 lakhs rupees. But it is not for ganja alone. 2 years imprisonment and 50,000 rupees for fine is also wrong. But 5 years imprisonment and 50,000 is according to our constitutional law. We can say that is the correct one. That's why shown in the table. So none of the above is also not the answer. So the student will be knowing what is the answer for punishment of that is contravention related to only for ganja means 5 years imprisonment and 50,000 rupees fine. So the sixth question, medicinal and toilet preparation manufacturing in presence of excise officer is medicinal and toilet preparation. Toilet preparation means that it may contain alcohol, and even sometimes some toilet preparation comes with other narcotic drugs also. So we should know what is toilet. See, the list under the Constitution of India, in such an eventuality, the medicinal and toilet preparations excise duty act was established in 1955 to provide for the levy and collection of duties of excise on medicinal and toilet preparation containing alcohol, narcotic drugs or narcotics. What is a bonded and non-bonded laboratory? Already we have seen in the first question itself, but still I am repeating. The main difference is that a bonded laboratory is authorized by government to handle the test controlled substances, while non-bonded laboratory is not authorized to handle controlled substances. And also we have seen that it has been sealed and key is also controlled by the excise committee and excise officer. So they have given the answer choice for medicinal and toilet preparation manufacturing is in presence of excise officer is restricted. No, it's not restricted. Non-bonded laboratory is not the answer, and not restricted is also not the answer. Bonded laboratory, in the presence of an excise officer, the manufactured a toilet preparation in bonded laboratory. So you know what is bonded laboratory and non-bonded laboratory now very clear. And number 7, Medicinal and Toilet Preparation Act 1955 is effectively implemented throughout India from which date? From which year? That's what. It's a jurisprudence subject. That's why they have asked which year, which date, which year. So we should know that. What is the act? We know that toilet preparation contains narcotics or alcohol. Narcotic drugs may also be there. It is an act with provision of levy and collection of excise duty on medicinal and toilet preparations containing alcohol, opium, Indian hemp, that is cannabis, or other narcotic drugs. The act is effectively implemented throughout India from 5th April 1957. So remember 5th April 1957. They have given a choice. 2nd May 1956. No, it's not that date. 5th June 1957. No. 2nd April 1952. No. The answer is already, we know that 5th April 1957. Remember the students, very important, the toilet preparation implemented throughout India in the date 5th April 1957. When was the pharmacy bill introduced by the government in India? This question. The question was asked as, the pharmacy bill was introduced by government of India on, in which time? In parliament. This is the picture of our old parliament. New parliament picture also nearby is, I have taken that old one. The Pharmacy Act 1948 was intact on 4/3/1948. That means, and March 4th March 1948, with the following permissible: an act to regulate the profession of pharmacy wherever it is exempted, to make better provisions for the regulation of the profession and practice of pharmacy, and for the purpose of constitute pharmacy council. So this is the bill they have passed in 4/3/1948, or you can say March 4th 1948. So the year they have asked, whether it is 1940, no. 1947, no. 1847, no. It is 1948. Diacetyl morphine is also known as. This is a question, very interesting question. The student should know some of the things, narcotic drugs, because forensic drug, how it chemistry, pharmacy chemistry, pharmaceutical chemistry, or you are studying, and so that you should know, pharmacists know diacetyl morphine is also known as, what is it? It's a narcotic. What is also known as morphine means we know it is obtained from opium. It is an inactive principle of opium, morphine, codeine, thebaine. So this one, ganja picture, but ganja is not present in morphine is not present in ganja. Charas. Charas is an cannabis concentrate made from the resin of live cannabis plant, the resin, the gum exudate or resin which is obtained, they prepare and handmade in the Indian subcontinent and Jamaica also. So that is not containing this diacetyl morphine. I told morphine is the constituent of opium. And this is cocaine. Cocaine is not You cannot say cocaine is a tropane alkaloid that acts as a central nervous system stimulant. It is also cannot be this morphine, diacetyl morphine. So cocaine is different, it's a stimulant actually. And you can see this is the structure of cocaine, which is having the alkaloid, that means it is a tropane alkaloid structure. And heroin is dimorphin. Heroin is diamorphin, not dimorphin. Diamorphin is a diacetyl. That is diacetyl derivative of morphine. Morphine group which is having two acetyl groups attached. You can see the morphine when we were studying 3 benzene ring structure, which is having 2 acetyl groups. Clearly you can see in the structure. So diacetyl morphine is called as heroin. So they have asked the question, what is the name of diacetyl morphine? It's heroin. Understand? Heroin, it's a narcotic drug, most restricted drug. It should not be sold, it should not be carried, it should not be used. It is completely a narcotic drug controlled by the governments all over the world. So number 11, the Drugs and Cosmetic Act 1940, everybody knows, was last amended in year. Which year it was amended in which year they have asked. We know that Drug Cosmetic Act 1940, the rules in 1945 as amendment up to 31st December 2016. So this is 2024, but actually the amended up to 31st 2016. Now it is revised in 2014, but still the amendment, which is 1940 Act, is December 2016. So they have given the year 2005, 2008, no, 1995, no. 2016 is the correct answer because the amendment was given up to the December 31st, 1916. And the 12th question, if it is so, colored, coated, powdered or polished, that damage is concealed, or if it is made to appear or better and greater therapeutic value than it is real, then it is called as. See, you should read the question again and again. We know that fraudulence in the product, changing the product, low quality product, we know that adulteration, we know many were spurious, and these all words we know, but this is specially they have told what? Color is added, coated, powdered, polished, and sometimes damage is concealed and even making into a better product and better therapeutic value, attractive, like that if you make. What is the name of it? They have given a choice, spurious drug, no. Spurious drug means or imitating a drug product or the drug formulation which is manufactured. Same name, trade name or same spurious drug. And spurious cosmetics means cosmetics that are labeled as spurious when it is named resembles another cosmetics which is available, and the product resembles another cosmetics, or if manufacturer is informed to the misleading or fictitious, they are all spurious cosmetics. Adulterated drug, we know that less, another choice, another species, less therapeutic effect, or sometimes adulterated with an intentionally, non-intentionally, without effect. So the adulteration is a practice of substituting the original crude drug partially or fully with other similar looking substances, which is either free from or inferior in therapeutic activity, or a chemical property is not there, it is changed totally. These all are adulteration. But you see, a drug shall be deemed to be misbranded. What is misbranded drug? Misbranded drug means if it is so colored, coated, powdered or polished and damaged in concealed or if it is made appear better than the previous one, greater therapeutic value, and if it is not labeled in the prescribed manner which is given by the government of our government of India or any government, if it is labeled container any like magic or accompanying the label appearing a statement, design or device which makes false claim, it can do this, it can do that, exaggerating the drug, in which the false, misleading, they are called as misbranded drugs. So misbranded drug, the question answer is exactly misbranded drug, because they say that if it is so colored, coated, powdered or polished or damaged, in conceal, or if it is made up of appear to better and greater therapeutic value than it's really it is, and if it is misbranded, misleading in the label, then it is called misbranded drug. I hope now the students might have understood what is the difference between spurious drugs, spurious cosmetics and adulteration, and what is the misbranded drugs. Thank you for with me with the short class, and again we will come for the next 10 questions which for the next subject. So I hope now I have come to the almost all the secondary subject whichever they have given for questions to be taken in for exit exam. Now we will come back even to the cognosy or pharmacology, like that 10 question short classes will be helpful for the students, I hope. Thank you.